Vitamin B12 is one of the most crucial nutrients your body needs to function properly. Yet millions of people are unknowingly deficient in it, and that's a serious problem. Why? Because B12 plays a vital role in some of your body's most essential processes. It helps your body produce red blood cells, supports brain function, keeps your nervous system healthy, and even plays a role in DNA production. Without enough of it, your body and brain can't function optimally. But here's the scary part. B12 deficiency is shockingly common, and most people don't even realize they have it. In fact, it's estimated that up to 40% of people may have lower than ideal B12 levels, especially older adults, vegetarians, vegans, and people with digestive issues. Because the symptoms can be subtle and easy to overlook, many people go for years without realizing their body is starving for B12. That's why today we're diving deep into 8 major warning signs of B12 deficiency that you should never ignore. If you recognize any of these symptoms in yourself, it might be time to check your B12 levels and take action. 1. Extreme fatigue and weakness. Do you feel constantly exhausted even after a full night's sleep? Do simple tasks like climbing stairs or carrying groceries feel harder than they should? If so, your body might be struggling with a B12 deficiency. Why does this happen? Vitamin B12 is essential for red blood cell production. These cells carry oxygen throughout your body, fueling your muscles, brain, and organs. But when you're low on B12, your body doesn't produce enough healthy red blood cells. As a result, less oxygen reaches your tissues, leaving you feeling drained, sluggish, and physically weak. Think of it like this. If your body were a car, red blood cells would be the gas. Without enough fuel, your engine, your body, struggles to function. If you find yourself waking up tired, yawning all day, or feeling drained even after resting, it's time to pay attention to your B12 levels. 2. Frequent mood swings, anxiety, and depression. Did you know that your mood and mental health are closely linked to your vitamin B12 levels? A deficiency in B12 can quietly disrupt your mental well-being, triggering irritability and mood swings, increased anxiety and nervousness, and feelings of depression or hopelessness. The science behind it, B12 plays a key role in producing neurotransmitters like serotonin and dopamine, which regulate mood. When B12 levels drop, your body struggles to produce these feel-good chemicals, leading to a higher risk of anxiety, depression, and mood instability. Many people mistakenly assume they're just stressed or overwhelmed when, in reality, a simple B12 supplement could significantly improve their mood. If you've been feeling down, anxious, or more irritable than usual, it might not be all in your head. Your body could be crying out for more B12. Take a look in the mirror. Does your skin appear paler than usual or have a slightly yellow tint? If so, this could be your body waving a big red flag that your B12 levels are too low. Why does B12 deficiency cause pale or yellow skin? When your body lacks B12, it struggles to produce enough red blood cells. Instead, your existing red blood cells become fragile and break apart too easily, releasing bilirubin into your bloodstream. Bilirubin is a yellow pigment, and when it builds up in your system, it gives your skin a pale or jaundiced appearance. Warning: if you notice pale skin along with other symptoms on this list, don't ignore it. Your body may be desperately trying to tell you something. Ever experience that weird pins and needles feeling in your hands or feet? Most people assume it's just poor circulation, but in reality, it could be a major sign of B12 deficiency. Here's why it happens. B12 is essential for keeping your nerves healthy. It helps build and protect the myelin sheath, a coating that insulates your nerves, kind of like plastic around electrical wires. When B12 levels drop, this protective sheath starts to break down, leading to nerve damage that causes tingling in hands and feet, numbness or burning sensations, and loss of balance and coordination. Left untreated, this nerve damage can become permanent, so don't ignore it. Struggling to remember things? Feeling mentally foggy or slow? Vitamin B12 deficiency doesn't just affect your body, it can seriously impact your brain function too. Vitamin B12 is critical for cognitive function. It helps produce myelin, which protects brain cells and keeps neuronal signals strong and clear. Without enough B12, your brain slows down, leading to forgetfulness and confusion, difficulty concentrating, and trouble processing information. Some studies even suggest that B12 deficiency may be linked to dementia in older adults. Don't ignore frequent senior moments or brain fog. It might be something you can fix. Vitamin B12 deficiency can also take a serious toll on your heart. When B12 levels are low, your red blood cells struggle to carry oxygen efficiently, causing a rapid or irregular heartbeat, shortness of breath, and dizziness and lightheadedness. In severe cases, prolonged B12 deficiency can weaken the heart muscle, increasing the risk of cardiovascular problems. If your heart races or flutters unexpectedly, don't brush it off. Your body might be begging for more B12. Your mouth is one of the first places that can signal a vitamin B12 deficiency, yet many people don't realize it. If you've been experiencing unusual discomfort in your mouth or tongue, your body might be trying to tell you that it's running low on this essential nutrient. One of the most common oral symptoms of B12 deficiency is glossitis, which refers to an inflamed, swollen, or painful tongue. But it doesn't stop there. Other issues like mouth ulcers, burning sensations, and cracks in the corners of the mouth can also appear when your B12 levels are too low. Let's take a closer look at how B12 deficiency can impact your oral health, the symptoms you should watch for, and what you can do to restore your levels and prevent further discomfort. Vitamin B12 plays a critical role in maintaining the health of your nerves, red blood cells, and tissues, including those inside your mouth. Without enough of it, your body struggles to repair damaged cells, leading to inflammation, soreness, and slow healing in the oral tissues. A lack of B12 can also weaken your immune system, making you more susceptible to oral infections, canker sores, and gum issues. Over time, a deficiency can affect your ability to taste, speak, and even eat comfortably. If you've been dealing with recurring mouth problems that don't seem to go away, it might not just be bad luck. Your body could be craving more vitamin B12. If you have a vitamin B12 deficiency, your mouth may show several warning signs that shouldn't be ignored. These include a swollen or inflamed tongue, also known as glossitis, which may look redder than usual, appear smooth instead of bumpy, and feel swollen or tender. Some people describe it as a burning sensation, especially when eating spicy or acidic foods. Painful mouth ulcers can develop on the inside of your cheeks, lips, or under your tongue, and these ulcers may take longer to heal than usual. Cracks at the corners of your mouth, known as angular cheilitis, can also occur, resulting in painful, dry, or cracked skin at the edges of your lips. Some people with B12 deficiency report a persistent tingling, stinging, or burning feeling on their tongue or the roof of their mouth. In severe cases, glossitis can make it hard to speak clearly or swallow food comfortably due to the swelling and irritation. If you recognize one or more of these symptoms, it's a good idea to have your B12 levels checked as soon as possible. You might be wondering, why does a lack of vitamin B12 affect my mouth so much? The answer lies in B12's role in red blood cell production and tissue repair. When B12 levels are low, your body produces fewer healthy red blood cells, which leads to poor oxygen delivery to tissues, including those in your mouth. As a result, the cells in your tongue and gums don't regenerate as quickly, leading to inflammation, pain, and increased susceptibility to infections. In some cases, chronic B12 deficiency can also affect your nerve function, which might explain the burning or tingling sensations some people experience in their mouths. The bottom line? Your mouth might be one of the first places to reveal a serious nutritional deficiency. If you've noticed persistent symptoms, don't ignore them. It might be time to boost your B12 intake. Certain groups of people are more likely to develop a B12 deficiency, making them more prone to these mouth-related symptoms. You may be at higher risk if you follow a vegan or vegetarian diet, since B12 is found mainly in animal products. People who avoid meat, dairy, and eggs are at a greater risk of deficiency. Those over 50 years old are also at higher risk, as our bodies absorb B12 less efficiently with age. Additionally, individuals with digestive issues like Crohn's disease, celiac disease, gastritis, or irritable bowel syndrome (IBS) can have trouble absorbing B12. Those who have had weight loss surgery, such as gastric bypass, may also struggle to absorb B12 from food, increasing the risk of deficiency. Certain medications like acid reflux medications, PPIs, metformin for diabetes, and some antibiotics can interfere with B12 absorption. If you fall into any of these categories, it's especially important to monitor your B12 intake to prevent deficiency-related symptoms. The good news? B12 deficiency is easy to treat, and once you boost your levels, your mouth and tongue symptoms should improve. Here's what you can do. Eat more B12-rich foods such as lean meats like chicken, beef, and turkey, fish like salmon, tuna, and trout, eggs, dairy products like milk, cheese, and yogurt, and shellfish like clams, mussels, and shrimp. If you're open to it, beef liver is one of the most powerful natural sources of B12. For vegans or vegetarians, taking a high-quality B12 supplement is necessary, as plant-based foods don't naturally contain B12. You can also look for fortified foods like nutritional yeast, plant-based milk, or cereals. If your body struggles to absorb B12 from food or supplements, your doctor might recommend B12 shots for faster absorption, and of course get your B12 levels checked regularly. If you experience persistent symptoms, ask your doctor for a simple blood test to determine if you need more B12. Vitamin B12 deficiency is often overlooked, but its effects on your mouth, tongue, and overall health can be significant. If you've been experiencing a swollen tongue, mouth sores, or a burning sensation in your mouth, don't ignore it. These could be early warning signs that your body needs more B12. The best part? This is a deficiency that's completely reversible. By making a few simple dietary changes or adding a supplement, you can restore your B12 levels and feel better fast. If you found this information helpful, don't forget to like, subscribe, and share it with someone who might need it. See you in the next video.